To reduce your risk for the silent killer, ensure you have an adequate intake of omega-3 fats and reduce your consumption of omega-6. If you're already living with high blood pressure or cardiovascular disease, you want to optimize your balance of these fats. We'll show you how to do this in Chapter 8. In the meantime, let's pivot from blood pressure to lipids, the fats and cholesterol in your blood. Blood lipids. Much of the confusion surrounding dietary fats, the good, the bad, and the deadly, has to do with the effects that different fats found in your food has on the fats found in your blood. Here we'll cover the best available scientific evidence to help you separate good fats from bad fats when it comes to blood fats, which we call lipids. Saturated fat, and to a lesser degree omega-3 fat, have been demonized as contributing to heart disease because they typically raise LDL. Conversely, vegetable and seed oils, which are high in omega-6, have been celebrated as healthy for their ability to lower cholesterol. However, as previously explored, looking solely at total cholesterol and LDL has led us astray in trying to identify which fats we should welcome into our diet and which ones we should kick out. A study done in the UK looked at 4 different diets, all of which had polyunsaturated fats making up about 6% of the total calories. Where they differed was in the amount of omega-6 and omega-3. A diet that had an omega-6 to 3 ratio of 3 to 1, close to what we evolved on, led to improvements in blood lipids that were not seen in a diet that had an omega-6 to 3 ratio of 11 to 1. Reducing the omega-6 to 3 ratio increased LDL particle size and also increased HDL, both of which are beneficial for cardiovascular health. Another study, one that had participants from multiple centers across Europe, showed that certain fats were beneficial for the lipid profile in those with metabolic syndrome. A diet high in monounsaturated fat and a low-fat diet that contained extra omega-3s helped shift people from pattern B to pattern A lipoproteins, that is, from the harmful small dense to the benign large boring LDL, when compared to a diet high in saturated fat and a low-fat diet that contained sunflower oil. Triglycerides were also lowered in both these groups. Elevated triglycerides are a marker for increased cardiovascular disease. Recall that LDL per se isn't harmful. It's really the small dense LDL particles that tend to get you into trouble, and even more so, oxidized LDL particles. In a study of people with familial hyperlipidemia, genetically very high cholesterol, omega-3 supplementation, 3.4 grams of EPA and DHA, lowered triglycerides by over 25% in just 8 weeks. Not bad. Their LDL went up by 21%, but the increase was primarily due to a greater number of the large boring type, and there was a reduction in the small dense type. So omega-3 led to an increase in the total amount of LDL, but the pattern shifted to one that's better for cardiovascular health. At least 7 trials have found that omega-3s increase LDL particle size or shift LDL from pattern B, bad, to pattern A, good. Conventional medicine needs to stop looking at LDL as the bad guy. Like so much in health and nutritionists, it's just not that simple. Let's look at a study where men with poor lipid profiles followed one of 3 diets: one enriched with flaxseed oil, high in omega-3 ALA, one enriched with sunflower oil, high in omega-6, or one enriched with sunflower oil plus fish oil, high in the long-chain omega-3s, EPA, and DHA. After 12 weeks on their diets, men in all 3 groups had lower cholesterol levels than when they started. However, triglycerides came down only in the men in the flax and fish oil groups, not those in the sunflower oil group. And another change you can hang your hat on by now. The fish oil group had a reduction in small, dense LDL and an increase in HDL, with a decrease in triglycerides coupled with an increase in HDL. The men in the fish oil group saw a substantial improvement in the risk for coronary heart disease. This ratio triglycerides to HDL is a better predictor of CHD than LDL. It's worth noting that some of the benefits observed in the fish oil group, such as increase in HDL and a decrease in small dense LDL, were not seen in the flax oil group. So even though flax oil is high in omega-3 from alpha linoleic acid, ALA, EPA and DHA are more powerful when it comes to improving markers for heart health. The improvements seen in the men in the fish oil group seem to correlate with higher amounts of DHA in their tissue. DHA versus EPA for blood lipids. When it comes to improving blood lipids, it appears there's something unique about EPA and DHA that's not found in ALA. So to improve your lipid profile, it might not be enough to simplify or to simply increase ALA, commonly referred to as plant omega-3s. In general, you might need to be more specific by consuming EPA and DHA, but which? Both? Let's take a closer look at this. The improvements in LDL size and density seems to be due mostly to DHA rather than EPA. In a study of healthy people with normal cholesterol, HDL levels increased by 13% when subjects took 2.3 grams of DHA per day, but not when they took about the same amount of EPA. DHA is also better than EPA for reducing triglycerides. In patients with abnormal lipids, 3 grams of DHA per day reduced triglycerides levels more than the amount of EPA. Independently of EPA, DHA also seems to have protective effects against cardiac arrhythmias and abnormal heartbeat, clotting, and arterial plaque formation. This may seem like a moot point because the fact is, unless you have access to highly processed oils, it's almost impossible to get pure EPA or pure DHA, as they occur naturally in foods that are typically found together. Most omega-3 supplements also contain both, though they usually have a little more EPA than DHA, but some brands are higher in DHA than others, and this might be beneficial if you're looking to take advantage of some of the specific properties that DHA has to offer. Platelets and coagulation. Platelets are the cells in your body, in your blood, responsible for coagulation, for forming clots. At first glance, blood clot sounds like a bad thing. After all, blood clots are big players in heart attacks and strokes, and if a clot breaks away from a blood vessel and travels to the lungs, it can actually be deadly. That's a pulmonary embolism. But not all clotting is bad. Just as with inflammation, clotting is a natural, normal, life-saving process, one that can keep you from bleeding to death. As long as it happens where and when it's supposed to, the trouble comes when the blood becomes too viscous and thick and prone to excessive clotting. Drugs referred to as blood thinners are designed to help people whose blood clots too easily, which puts them at risk for strokes, heart attacks, and pulmonary embolism. It's been known for quite some time that EPA and DHA are natural blood thinners. High-dose EPA and DHA might even work like patented pharmaceuticals do, but with fewer side effects. EPA and DHA are both effective for this, but as we saw with effects on cholesterol and other lipids, DHA has a slight edge over EPA for reducing platelet aggregation, the formal term for clotting. But what if you don't like popping so many pills? Most EPA and DHA capsules are large, so maybe you don't like swallowing them, or maybe you simply prefer to get your EPA and DHA the old-fashioned way from healthy fish. If so, you're in luck. Fatty fish does the trick, and people who consume a little over a pound of oily fish per week for just 4 weeks, markers for platelet aggregation reduced by 35% compared to those people who didn't eat that much fish, and the markers went back to their previous values after the fish consumption stopped. This makes sense. Your body is a dynamic, ever-changing biochemical system. If you want to experience the positive effects of something, you have to keep doing the things that created those effects. If you want healthy teeth and gums, you can't just brush your teeth once and never do it again. You have to keep the habit up. Same with the healthy fats. Whether you get them from whole foods or from supplements, you can't expect you can't expect to continue reaping the benefits of omega-3s if you eat fish for dinner one evening and never have it again, or take EPA and DHA for a week but then forget about it after that. If blood clotting is a normal, natural process, is it possible to have too little clotting? We know that too much clotting could be a disaster, but you can take so much omega-3 that your blood doesn't clot enough. Thick, viscous blood is hard for the heart to pump, but what if your blood gets too thin? This seems to be an unfounded fear. A researcher who looked into this issue found that patients who had been supplemented with omega-3 prior to major surgeries had a virtually non-existent risk for significant bleeding. Women sometimes lose a great deal of blood during childbirth, for instance, but one study found that pregnant women who had consumed about 2.7 grams of omega-3 daily did not have increased blood loss during delivery. One group of people who might want to be careful with omega-3 supplementation are those already taking blood thinning or anticoagulant medications. If you're already taking a powerful drug to thin your blood, thinning it even more could have undesirable effects that just makes logical sense. But the fact is that evidence indicates that even for those people, omega-3 supplements don't increase the risk for bleeding problems. The following are beneficial effects of EPA and DHA on lipids. In all cases, DHA is more potent than EPA, but that's not to malign EPA or make it sound unimportant. EPA has other positive effects outside the cardiovascular system, so you shouldn't avoid EPA. It just means that if you're looking for a good EPA and DHA supplement, you might do best to look for one that's high in DHA. We'll show you that how to choose appropriate supplements in Chapter 8. The benefits of EPA and DHA on lipids and platelets include reduced triglycerides, reduced small dense LDL, increased large buoyant LDL, increased HDL, optimized platelet aggregation, excessive clotting. Heart attack and sudden cardiac death. The most common symptom of heart disease is unfortunately sudden death, as it is responsible for 50 to 60% of all deaths from coronary artery disease, which is why it is vital to have a proactive approach. Most people with heart disease don't get a second chance. Around 300,000 people in the U.S. die every year from non-traumatic out-of-hospital sudden cardiac arrest. That is, their heart stops without warning and it doesn't start again. Many of these cases are caused by abnormal heart muscle contraction, called fibrillation, due to clotting. EPA and DHA may be one of the best strategies for reducing this risk. Studies suggest that if your intake of omega-3 is low, especially if it's combined with a high intake of omega-6, you're at greater risk not only of having a heart attack but also of dying from one. In a study out of Italy, patients who supplemented with EPA and DHA after a heart attack had a lower rate of sudden cardiac death within 4 months. In 2003, the European Society of Cardiology recommended that fish oil be part of standard patient treatment after a heart attack. In fact, it's been shown that just 3 months of fish oil supplementation can reduce mortality after a heart attack. Evidence from many trials indicates that fish oil reduce cardiovascular mortality from 30% to 50% and may reduce sudden cardiac death as much as 45% to 81%. If a pharmaceutical company could develop a drug with those kinds of benefits, it would be a goldmine that would no doubt cost you a fortune to refill at the local pharmacy. But lucky for you, you can head to a health food store and get these same benefits with a good quality EPA and DHA supplements. The incidence of sudden cardiac death in the general population of Western countries is almost 20 times greater than that in Japan. As the omega-3 index strikes again, the average omega-3 index in Japan is about 10%, compared to just 4.5% in Western countries. An omega-3 index of 8% or higher is associated with a 90% reduction in the risk of sudden cardiac death compared to an index of 4% or less. Put differently, people with an omega-3 index below 4% have a risk of sudden cardiac death 10 times greater than those whose index is above 8%. People with an omega-3 index of 5% have a 70% lower risk of cardiac arrest compared to people at 3%. So inching your index higher is certainly beneficial, but we could do better. For most of us, getting our index closer to 10%, as is found in Japan, might provide the biggest benefit for cardiovascular health. As you can see, the omega-3 index is a vital piece of information that will help you optimize your balance of EPA and DHA. Sadly, it is not available at most commercial labs like Quest or LabCorp, but there are specialty labs that will do the test relatively inexpensively and conveniently. There's no need to go to a lab. You merely request a kit, and once you receive it in the mail, you take a few drops of blood from your fingertip and apply it to a blotter card and mail it back to the lab. If you're interested in this test, you go to www.mercola.com/omega3test. Coronary heart disease. Southern Europeans, such as Greeks from Crete, are known for their low rates of cardiovascular disease. Compared to Northern Europeans who have higher rates of heart disease, their diets are higher in monounsaturated fat, mostly from olive oil, and lower in omega-6 fat. The primary type of fat in olive oil, called oleic acid, has been found to have multiple positive effects on cardiovascular health. It reduces the susceptibility of LDL to oxidation, reduces blood coagulation, and improves blood vessel function. Epidemiologically, a high intake of oleic acid, as in the Mediterranean diet, is correlated with a low rate of heart disease, while a high intake of omega-6 from vegetable oils is correlated with a high rate not only of heart disease but also high blood pressure, type 2 diabetes, and obesity. The most recent incarnation of the U.S. Dietary Guidelines from 2015 recommends the consumption of oils, which include olive oil of high omega-6 vegetable oils, with no details on which might be preferable. Perhaps that is better than not recommending olive oil at all. But as we've covered, there are many lines of evidence that suggest that olive oil, especially high-quality extra virgin olive oil, is good for your heart, while omega-6 rich oils are anything but. Extra virgin olive oil, going the extra mile. It is commonly believed that extra virgin olive oil, especially when compared to refined olive oil, is healthier due to its higher polyphenol content. One trial sought to determine whether the polyphenol content of olive oil matters for heart health. Considering the wide variety of olive oils available now, this is an important question. Is it good enough to buy whatever's on sale, or is it worth seeking out a specialty store and spending a few extra dollars for high polyphenol oil, which is typically more expensive? Individuals consumed either low, medium, or high polyphenol olive oils, and the results show that the higher the polyphenol content, the higher the HDL, and the lower their level of oxidized LDL. The authors wrote, olive oil is more than a monounsaturated fat. Its phenolic content can also provide benefits for plasma lipid levels and oxidative damage. Hippocrates, a Greek physician often called the father of medicine, said it best: let food be thy medicine, and medicine be thy food. How to find good olive oil. Testing of olive oil reveals anywhere from 60 to 90% of the olive oils sold in America grocery stores and served in restaurants are adulterated with cheap oxidized omega-6 vegetable oils, such as sunflower oil or peanut oil, or non-human grade olive oils, which are harmful to health in a number of ways. Even extra virgin olive oil is often diluted with other less expensive oils, including hazelnut, soybean, corn, sunflower, palm, sesame, grapeseed, and or walnut. These added oils will not be listed on the label, so most people will not be able to discern that their olive oil is not 100% pure. Similarly, the use by or sell by date in the bottle really does not mean a whole lot. as there's no regulation ensuring that the oil will remain of high quality until that date. The date you really want to know is the pressed on date or harvest date, which are essentially the same thing because olives go bad almost immediately after being picked. They're pressed into olive oil basically the same day they're harvested. High quality olive oil is pressed within a couple of hours of picking. Poor quality olive oils may be pressed 10 hours after the olives are picked. Ideally, the oil should be pressed in under an hour, but certainly within a few hours. The harvest date should be less than 6 months old when you use it, but unfortunately, the few olive oils actually provide a harvest date. As for olive oil in restaurants, more often than not, the olive oil served for bread dipping is typically of very poor quality and is best avoided. Olive oil is extremely perishable even when used cold, thanks to its chlorophyll content, which accelerates decomposition. If you're like most people, you're probably leaving your bottle of olive oil right on the counter, opening and closing it multiple times a week. It's important to remember that anytime the oil is exposed to air and or light, it oxidizes, and the chlorophyll in extra virgin olive oil accelerates the oxidation of the unsaturated fats. Clearly, consuming spoiled oil of any kind will likely do more harm than good. To protect your olive oil from rancidity, be sure to keep it in a cool, dark place. Purchase smaller bottles to ensure freshness. Immediately replace the caps after each pour. As for the best place to buy olive oil, look for stores where taste testing is allowed and encouraged, such as gourmet stores or specialty retailers. So how can you distinguish superior olive oil from an inferior one, or tell whether your olive oil has gone bad? Here are 4 telltale signs to look out for. Number 1, rancidity. If it smells like crayons or putty, tastes like rancid nuts, or has a grassy mouthfeel, your oil is rancid and should not be used. Number 2, fusty flavor. Fusty oil occurs when olives sit too long before they're milled, leading to fermentation in the absence of oxygen. Fusty flavors are incredibly common in olive oil. So many simply think it's normal. However, your olive oil should not have a fermented smell to it, reminiscent of sweaty socks or swampy vegetation. To help you discern this particular flavor, look through a batch of Kalamata olives and find one that is brown and mushy rather than purple or maroon black and firm. The flavor of the brown mushy one is the flavor of fusty. Number 3, moldy flavor. If your olive oil tastes dusty or musty, it's probably because it was made from moldy olives, another occasional olive oil defect. Number 4, wine or vinegar flavor. If your olive oil tastes like it has undertones of wine and vinegar or even nail polish, it's probably because the olives underwent fermentation with oxygen, leading to this sharp, undesirable flavor. Here's a summary of various tips gathered from experts about how to find the best quality olive oil. Harvest date. Try to purchase oils only from the current year's harvest. Look for early harvest or fall harvest. Storage and tasting. Find a seller who stores the oil in clean, temperature-controlled stainless steel containers topped with an inert gas such as nitrogen to keep oxygen at bay in bottles it as they sell it. Ask to taste it before buying. Color and flavor. According to Guy Campanile, an olive oil producer, genuine, high-quality extra virgin olive oil has an almost luminescent green color. However, good oils come in all shades from luminescent green to gold to pale straw, so color should not be a deal breaker. The oil should smell and taste fresh and fruity, with other descriptions including grassy, apple, green banana, herbaceous, bitter, or spicy. Spiciness is indicative of healthy antioxidants. Avoid flavors such as moldy, cooked, greasy, meaty, and metallic, or resembling cardboard. Bottles. If buying pre-bottled oil, favor bottles or containers that protect against light. Darkened glass, stainless steel, or even clear glass enclosed in cardboard are good options. Ideally, buy only what you can use up in 6 weeks. Labeling terms. Ensure that your oil is labeled extra virgin, since other categories, pure or light oil, olive oil, and olive pomace oil, have undergone chemical processing. Some terms commonly used on olive oil labels are meaningless, such as first pressed and cold pressed. Since most extra virgin olive oil is now made with centrifuges, it isn't pressed at all, and true extra virgin olive oil comes exclusively from the first processing of the olive paste. Quality seals. Producer organizations such as the California Olive Oil Council and the Australian Olive Oil Association require olive oil to meet quality standards that are stricter than the minimal USDA standards. Other seals may not offer such assurance. Of course, finding USDA certified organic is a bonus, but not the only consideration. Though not always a guarantee of quality, PDO, Protected Designation of Origin, and PGI, Protected Geographical Indication status, should inspire some confidence. Storage and use. Keep your olive oil in a cool and dark place, and replace the cap or cork immediately after each pour. Never let sit exposed to air. Prolonging freshness. To slow oxidation, try adding 1 drop of astaxanthin to the bottle. Astaxanthin is red, so it will tint your olive oil. As the olive oil starts to pale, you know it's time to throw it away. Alternatively, add 1 drop of lutein, which is orange in color. Vitamin E oil is another option, but since it's colorless, it will not give you a visual indicator of freshness. Riding the nutritional ship. When it comes to dietary fats, you're in backwards world, where up is down, down is up, and the oils have been promoted as being good for your heart health are just the opposite. Excessive linoleic acid consumption promotes oxidative stress, including oxidized LDL, chronic low-grade inflammation, hypertension, arteriosclerosis, and heart arrhythmias. It is undoubtedly a major contributor to heart disease and overall cardiovascular disease, especially when consumed as industrial seed oils, and even more so when combined with a diet high in sugar and other refined carbohydrates. Whole foods in LA do not seem to be as problematic, and in some instances, they provide health benefits due to their inherent antioxidants, vitamins, minerals, healthy omega-3s, and other whole food constituents that help protect the LA from oxidation. For example, most nuts and seeds are good sources of vitamin E, which is a potent antioxidant that may help protect the fragile omega-6 from being damaged. However, in most industrialized nations, the majority of omega-6 no longer comes from whole foods, such as fish and other seafood, nuts, seeds, and eggs. It now comes from chemically unstable and easily damaged industrial seed oils. Since the average consumption of these industrial seed oils is around 40 to 55 grams per day, and most of these societies compared to an almost negligible EPA and DHA intake of just 0.1 to 0.3 grams per day. The omega-6 to 3 ratio has shifted from the one that kept us healthy and robust for millennia to one that promotes inflammation, arteriosclerosis, and hypertension. Reducing your intake of industrial seed oils and increasing marine and plant omega-3s may be one of the most effective and simplest strategies for reducing your risk for cardiovascular disease.